All right, good morning. So today we are going to go over the last set of notes for this chapter on infection control. This section is covering bioterrorism. So what is bioterrorism? Bioterrorism is the use of microorganisms or biologic agents for warfare. So basically it's the use of, pathogens, germs, bacteria, anything that's, living as a means of warfare. So this is something that I know people believe. There's like conspiracy theorists that believe that coronavirus was spread, from China and that it's a bioterrorist attack. We obviously don't know that for sure. I want to believe that's not true, but again, it is a possibility. And even if that's not true, like I said, there's conspiracy theorists right now. There still is a threat. And it's just important for healthcare workers to essentially be prepared for something like this to happen. As you guys are well aware, we obviously know how crazy the beginning of the pandemic was just because of the fact that we were not prepared for something like this to occur. And so this can also happen again through a terrorist attack. Not trying to scare you guys, but it's just something that healthcare workers do need to be aware of. And so this actually has happened over periods of time. There were actual programs in the United States and Russia where I think up until the 1960s, they had biological agent like programs. And so essentially, they were creating these diseases or biological agents to be intended for warfare. But then in 1960, they basically decided that it's kind of inhumane. So they stopped doing that. But again, it is a possibility. So if there were to be a bioterrorist attack, and again, not trying to cause panic with you guys, microorganisms that would be suitable for bioterrorism have to have certain characteristics. So in order for them to be a good biologic agent, they should most likely be inexpensive. That way you can spread it more. They need to be obviously easily produced, again, where the spreading is quickly. They need to have the ability to maintain their survival. So a lot of pathogens, diseases, things like that need to be in a warm, moist environment. And so the type of disease or pathogen that they would potentially want to use would be something that can, survive in sunlight, has the ability to, maybe have like a spore around it, so it's harder to break apart. And then obviously it would be something that would bring, death to people or even severe disability to them. Easy for it to travel from person to person. So, breaking that chain of infection would be much more difficult. And then also difficult to prevent and then also difficult to treat. So, again, not trying to, cause fear or anything like that. But these would just be things that if somebody were to be wanting to perform a bioterrorist attack, they would want a type of microorganism that has all of these qualities. In 2001, there was actually a bioterrorist attack in America, and I think you guys were not even born yet, which is kind of crazy. But this happened starting a week after 9/11. So, America, again, you guys weren't born, so you don't know what it was like, but America was already on a really heightened level of fear and, dealing with all of the stuff that, came from the World Trade Center collapsing and all of the attacks on the Pentagon, that sort of thing. So they're already heightened fear. And then somebody basically was going and mailing anthrax into envelopes. So anthrax is a type of bacteria. And so it's typically found like in soil and it can stay in soil for years. Animals typically will consume it and then they'll get sick. It's not usually common for humans to come into contact with it. However, this bacteria, the person, I don't remember who the person who was mailing it, turned it into like a powdered form. And so essentially, when people would open up their mail, they would, breathe, and that powder would then be dispersed into the air, and then they would inhale it, and then they would start to get really sick. And so people ended up dying. The letters weren't mailed to just like the general public, they were mailed to people like in Congress, so public officials. And yeah, it was something that was really scary at the time. I was young, so I don't really remember the fear level exactly, but that I would say is probably one of the most recent things that we've had in America related to bioterrorism. These are just some examples that could potentially be biologic agents used in a bioterrorist attack. So smallpox, I'm sure you've learned about it in history class, but smallpox is a highly contagious and it's an infectious disease. So it causes, like sores all over your body. Up until I think it was like the 1970s, 1960s, there actually was a vaccine for smallpox. And so after I think the 1980s, they realized that there really hasn't been a person with smallpox. They kind of eradicated it through vaccines, that they stopped recommending vaccinations for smallpox, because if the disease isn't around, then we don't really need to be vaccinated for it. However, there is that threat, though, that it could potentially, be used as a biological weapon. So they still recommend people who are first responders, emergency healthcare professionals, to get this vaccine just to be safe, but the general public typically doesn't get a smallpox vaccine. Anthrax, like I talked about, so again, just know it's a bacterial infection. The plague, so if you think back a long time ago, we talked about like the history of healthcare. The bubonic plague, if you remember, killed millions of people during the Middle Ages, and so this infectious disease still exists. We obviously have better treatments to prevent it from causing serious infection or death. But again, that could be something that could potentially be spread, which is why health workers just need to be aware of this. Botulism is something that is circulating in a lot of things. Botulism is essentially a type of bacteria, and it causes a nerve toxin. So if you think, I'm sure you guys have heard of like Botox. Botox is a form of botulism. So essentially what botulism does is it paralyzes the muscle or whatever it is that it's affecting. And so with Botox, you paralyze, the muscle on someone's face, and then they don't have the wrinkles anymore. However, if you paralyze muscles that are responsible for breathing, your heart rate, things like that, then that can obviously cause serious illness and potential death. Tularemia is another type of bacterial infection. And so this one is typically caused by bites from like ticks or mice, and it can cause serious disease as well. There is, I believe, a vaccine for this one, though. If you work in the military, they typically recommend you get vaccinations for a lot of these different ones. And then the last thing I'll talk about is Ebola and Marburg. So they're two versions of the filovirus. So there was an outbreak, I believe, in 2014. I think we've talked about this previously. That was not a bioterrorist attack. That was just, there was an outbreak. But again, Ebola is highly contagious. It's pretty lethal, I believe. I think it's like 50 to 70% of people that contract it, it is fatal. And that's just because we don't have treatment for it. So if you look at these, a lot of the different diseases are bacterial infections. There's a couple viral infections, but the reason why I would say that they're talking about bacterial is just bacteria, remember, can stay on surfaces for longer periods of time versus a virus needs a living host. So the virus can be very infectious if you have, people to jump from, but the bacterial infections are scary just because they don't need someone to survive. So you can have, that fomite surface and somebody touches it and then potentially can get infected. If there were to be a bioterrorist attack, again, not trying to cause fear, but it would obviously be a public health emergency. It would heavily impact healthcare facilities. So this says social disorder would ensue. I kind of look back into how we handled the pandemic in America. There was social disorder. And that's not, like I said, I don't believe the pandemic, what's going on with COVID-19, is a bioterrorist attack. I believe it's just a pandemic. But if you look at how that was handled, people were panicking. They were buying toilet paper. Why? It wasn't a, digestive system affected illness. So I honestly never understood that. But yeah, people were panicking. People were buying tons of food. I went to the grocery store and I couldn't find like anything the week after everything was starting to get shut down. So they would obviously need to have a plan for that. I think we're better prepared now because we have been going through a pandemic and people maybe are more aware that okay, it's not the end of the world type of scenario. We don't need to hoard hundreds of rolls of toilet paper. But yeah, having a comprehensive plan is important. What would you do if something like this were to happen? Who's going to be first vaccinated? Again, this is kind of related to just the pandemic as well. In 2002, there was an actual act passed by Congress. And so basically, what this Bioterrorism Act stated was that local government, regional government, state, national government, all of them need to have some way to have early detection so that we know if there is some type of weird infection going on, people are getting sick, that they need to have a plan for that. And they're just making sure that public is notified. Obviously, proper infection control should be given, education, funding available. So all this stuff was intended in 2002 to prepare the United States for a bioterrorist attack. And I think there are some issues with what happened at the beginning of the COVID-19 outbreak was that we realized that we were not prepared. So hopefully one of the positive things that maybe can come out of our COVID-19 pandemic is that we are prepared for potential pandemics and also better prepared for maybe a potential bioterrorist attack. If there were an attack, though, you obviously need to have your guidelines. Immunizations would be important if they do have them. So, like smallpox, there is a vaccine. So, if there was a smallpox bioterrorist attack, we'd make sure that people are getting vaccinated for that. Making sure that there is, food and water supplies are protected because some of these, since they're bacterial infections, can be spread through water. It's not just like coughing, sneezing, that sort of thing, making sure people are trained, obviously investigating those threats, preparing those healthcare facilities, and then communicating again locally, regionally, statewide, and nationally. And then just a summary, like I've said several times, not trying to cause panic, just making sure that healthcare workers are aware that bioterrorism could potentially happen. An attack can obviously occur at any time. And just making sure that you are prepared if you do plan on working in healthcare. Again, this kind of is just also related to the pandemic, just making sure that if you do plan on working in healthcare, could be a potential pandemic happening, in the future. We never really had one, I would say, in I think the past 100 years, but if you never know. I mean, the world is getting more populated, so the potential for more infection because there's more people is greater. But anyways, make sure you turn your notes in by the end of the period, and I will see you guys tomorrow. Have a good day.